Okay, welcome everyone to another rendition of Faith Community Nursing chatting about advanced care planning. I want to take a moment to introduce Lanet Owens. Lanet is a Faith Community Nurse Coordinator at Bartow Regional Medical Center at Winter Haven Hospital. She is the Polk County Faith Community Nurse Program Outreach Coordinator with Baycare Health Systems Faith Community Nurse Program. And she is a member of the Faith Community Nursing International Group and is an active member of the research committee. Prior to relocating to Baycare in August of 2017, she worked for Memorial Hospital and Healthcare Center in Jasper, Indiana for 32 years. She's experienced in surgical and post-recovery nursing. She completed the University of Southern Indiana School of Nursing and Tri-State Healthcare Ministry Organization's Basic Parish Nurse Education Program in 2002. In 2004, she completed and received a certification of completion from the International Parish Nurse Resource Center's Coordinator course. And in 2000, that was in 2004. And in 2009, she took the Parish Nurse Educators course. Presently, she's working part-time doing health ministries that oversees community outreach services such as mental health, offering mental health first aid, and advanced care planning education. So quite a resume. And Lanet, thank you again for coming and being willing to talk with us about advanced care planning and kind of the work you're doing within faith communities to further that cause.
Well, thanks, Lisa. I really appreciate it. It's an honor to always talk about the things that you just discussed that I have a passion about, and to be able to share them with other faith community nurses, especially in this time period that we just went through during the pandemic.
Yeah, no doubt the pandemic has given us a lot of cause for pause to be still and to be thinking about what God's doing in all of this and how that impacts our lives individually and the lives of faith communities in a number of ways. So let's start a little bit. Talk to me about your experience as a faith community nurse with end of life and advanced care planning.
Actually, I mean, when you work in the areas that I worked in before faith community nursing, which I continued to work in up until I left Indiana. What I mean by that, I still worked in recovery. Even though most of our patients were, most time they were very sick, and, you transfer them to intensive care and that kind of thing. But you see that there's not a completion, or we don't embrace the next life. And so in faith community nursing, when we would do our yearly events at the Westburg Symposium, one year in particular, I can remember, I think it was about 2012, most of the presentations were on end of life issues. And so I made a point to, be in those sessions. And I had one of my colleagues from Chicago to say, at our hospital, we decided we really wanted to do it well. We were piecemealing, having conversations with individuals, and we didn't feel comfortable as faith community nurses always talking about end-of-life issues. And so we heard about an organization in Wisconsin, in La Crosse, called Gunderson Lutheran Hospital, where they had been doing advanced care planning for years, and their statistics, or their evidence-based practice program, had proven that it had, was very successful. One of my other colleagues back at Memorial, who was the head of intensive care, had also found that same material. And so as a hospital in Indiana, we decided that, hey, let's try to make a change as a hospital model. So we went to Wisconsin to take the Respecting Choices training, which was 5 days. And we, after it was all said and done, there was like a $20,000 investment. But when you go there, the first part of the training is training you to be a facilitator, just to have the conversations. But if you stay, you can also become an instructor of the model, bring it back to your area so that you can train other facilitators. And that's really what you should do. And I think what validated it for me, and then we'll go on to the next question, is when I got there, I turned around and one of my other colleagues from Detroit, which is was over from the Henry Ford Macomb Hospital that owns the Faith Community Nursing documentation system, was sitting right behind me. And she's a mentor as well. And they actually, when both of us left the program, they went back and they actually put a place in the charting system that mirrored the Respecting Choices plan.
Wow.
So that they could start catching that with evidence-based practice. So.
Yeah. Well, I mean, it tells you how robust Respecting Choices is. And one of the things I'll point out as we have a conversation, for those of you that are just joining in on this and listening in, is, part of this conversation is around this development of an advanced care planning training tool that's specifically for faith community nurses, that just really is pulling together all the existing resources that are out there. And Respecting Choices is a very robust, evidence-based educational model that has various levels of training, like Lanet mentioned, that can be a great asset for a faith community nurse. And it doesn't necessarily mean you have to spend lots of time and money in that. There's various levels and even free modules online. And we'll put some links at the end of the video for people that are interested in learning more about that. And certainly it will be embedded in the tool. And so, Lanet, can you tell me about a specific situation where you were able to provide, as a faith community nurse, intentional care of the spirit as it relates to end-of-life care and advanced care planning?
I can, and I'm going to speak to one specific couple that I worked with. Now, when I share this story with you, it doesn't necessarily mean that I'm using exactly the Respecting Choice model. But I think what you need to realize on the Respecting Choice model, it's whether they're healthy or whether they're chronically ill. And that kind of guides what you're. So because of, again, one of the parts of the Respecting Choice model is also doing a presentation out in the community that you're introducing them to. Have you thought about, will somebody speak for you if you cannot speak for yourself? That's the question. You can have all kinds of models, but you're hoping that's the first question in that model when you're having a conversation. Right.
Getting them started. Yeah.
Getting them thinking, plant that seed. So we had a couple to call us. We set up our health ministry office up in Indiana, where, again, as a facilitator instructor, where they could call in if they wanted to come in and meet with you, and we would discuss, you can say end-of-life issues, but the advanced care planning process. I'm going to repeat that for the nurses that are listening. The document is the ultimate goal, but it's really the advanced care planning process. Because if you speak to it that way, or how do you embrace, your family to have this discussion, or if it's a husband and wife, how do you share those things so that it's a comfortable setting as much as possible? We had a small conference room. They would come in. I would lay documents out on the table. I would offer water.
We're getting some technical difficulties, but we're coming back. We're coming back. There we go.
Okay. So I'm going to back up a little bit. And maybe
that's okay. Hey, technology, we go with the flow here.
So anyway, okay, so the couple got I say got a hold of me, that's not the correct, but the couple called in, we made arrangements, made an appointment, we had a conference room, wanted to make them feel comfortable, offered them water, laid the documents out on the table. So I think the thing to clarify, again, it's a process, and it was 4 different meetings with this couple before the document was completed. The thing that when having conversations with individuals, and I think you have to do your own homework before you even have those conversations. You have to feel comfortable with yourself, and sometimes have your own documents completed.
That's right.
But health literacy is that's another term that if you're listening to this podcast, hopefully you've heard of health literacy before. A lot of people have it, and it's on both sides, whether you're teaching or whether the receiver, because those documents are written most of the time at the 12th grade level, and most individuals can only interpret at the 6th and 8th grade level. So the example with the couple is there's one part of one of the documents called 5 Wishes that I was using, where it talks about, do you want an NG tube? One of the wife said yes when she first filled out her document. They went home with the documents, looked over them again, and the reason she said yes, because she had saw a premature grandbaby live from having an NG tube placed. So once they got home and got to talking, she realized, no, really, so we had to redo the document, which is fine, and that kind of thing. And so once we redone the documents, got them all set, then who's going to sign the documents? And if you, that's another thing, you need to look through the documents and make sure the document says, and in 5 Wish, it really doesn't want, if you're a healthcare organization working with individuals and they come in, it really shouldn't be you signing off on their signature. It should be somebody that knows them. And I've been to big meetings before, not to vary from this conversation, but where they were filling out documents in a room of 500 people, and a lady says, oh, I'm going to fill out my name. Will you witness my signature? How do I know? After meeting her for 2 hours, that's really the person. You see? So anyway, you need those kind of things. So anyway, we arranged for a home meeting. We also called another faith community nurse from within the church of the couple and asked if she knew of couples that might, be willing to witness their signature. I then called those individuals. So there's a lot of things to think about. And then the most important thing, if you're helping a couple work with, or any person, whether it be a single person, or to finish a document, you want to make sure there's plenty that you encourage them to always have the original.
Yes.
And you also want to make sure there's copies for all their physicians and the hospital. And you really instruct them that no matter, the doctors might have the copies, the hospital may have the copies. If they're, have an immediate emergency and they have to go in, make sure they take the document with them. I think in the future, there's already websites that you can fill out your advanced care plan. You get the little black box and you can show it on your phone. So there's going to be new technology for advanced care, whether it's already out there. It's just, are you, know about it and will you use it? So
yeah, and I think you brought up a good point too, to reiterate to everyone that, if you're a faith community nurse and you're just thinking about dipping your toe into this work and considering that, planting seeds like Lanet mentioned. And then if someone does complete a document, really encouraging them to make those photocopies, give it to family members, give it to their providers, so the hospitals have those, so that they just know how to manage those documents. This is not a document that you fill out and stick in the safe that you don't think about for 6 years or 20 years and never tell your family or kids about. And so that's another really simple and subtle role that nurses can play in faith communities. If you've identified someone who's even completed documents already, if you're not comfortable and you haven't been through the extensive training Lanet's been through, to be able to say, well, have you shared that with your family? Have you shared that with your doctor? And just fostering that along. So those are really good points. Now, next question here. What do you think the role of the faith community is with helping people prepare for future medical care?
Really, and this is kind of happening to me in Florida. I'm kind of getting adjusted in a new church. I really think that there should be just a short presentation, set an hour, ask the joy group sometime or the senior group if you can come talk, and, really explain, ask them, if you can. And I have a program that's really called Lovingly Embrace Eternal Perspectives. Because if you say, oh, I want to come in, I don't want to talk to you about documents of end of life, they go, it's like, hands up, no way, I'm scared. Or they'll say, oh, I've already talked with my attorney, we have that filled out. Yeah, and most of the time, and that's great that they have done that, but you may have to investigate a little bit further, because in the attorney documents, most of the time, it's just, do you want CPR or not? And sometimes there can be way more to it. Again, is there a tube feeding? Have they had a stroke and they're not, I mean, there's specific medical situations that are not always addressed in a legal document where an advanced care plan would have more detail.
Yeah.
And try to find somebody that, again, in the medical profession that can interpret all those medical terms for you. Again, that's where the health literacy thing kind of comes into play.
Yeah, absolutely. And I think, too, to reiterate that the process of advanced care planning is continual. I mean, people should revisit that, and, things might change, or circumstances, their beliefs about certain procedures might change. And then also the spiritual component of the significance. What does all of this mean? And pointing people to begin thinking about that. And one of the things that I may have shared with you before, but is when you think about in the Christian Bible, when Christ is talking to his disciples about his impending death and suffering, and of course resurrection, that the disciples didn't want to talk about it either. So
that is very
we're in good company, and Peter was rebuked by Christ, saying, get behind me, when he's like, no, you're not going to really die. You're really not. And Christ set that example. So I think we're in good company, knowing that human beings and faith communities, all of us, it can be difficult to talk about, but it's a part of who we are. Can I go back then? Yeah, please.
Just a minute on that spiritual component, because you asked me that a while ago. So if I do a community presentation, I really like to tie in the Respecting Choices story. I want to say, I want to use the word mascot, but I guess that'll work. There's a starfish. And so for their community presentation, they advise you use the starfish story, which I like. It's the starfish story. If you haven't heard it, the gentleman is walking down the ocean. All the starfishes that wash up on the sea, throws them back in. And somebody's walking down along the ocean, said, "Why are you throwing the starfish back?" And he goes, "Because if I can save one." And so that's the key about advanced care planning. If I can help one, because there's a benefit and a burden there. So when I first started doing Faith Community Nursing's Respecting Choices community outreach program, I got to doing a little research about starfish, and it has a cousin, the sand dollar. And if you look at sand dollars in the ocean are very colorful, but when we pick them up on the ocean, they've been bleached white. So I like to tie in that we're like sand dollars. One of these days, is that your goal? Is it hopefully that you will be bleached white when you transition from this life to the other? So I'll start out that way. And back to the thing that we were talking about, revisiting the document. If you're fortunate enough to work through the process with somebody and you get the document, again, the community presentation talks about revisit it every decade, or if you get a divorce, or if you move, or if you have certain individuals that you've asked to be your proxy or your surrogate. What if they don't want to do it anymore? You want to stay in touch with those individuals and make sure they're going to say, be your advocate if you put them on a document. So
absolutely. Good idea. And I like the idea. It's kind of like checking your smoke detectors, in your house. Just make it a part of your routine once a decade, or when big changes happen, to go back in those documents and see what makes sense. And I may have shared with you, but my husband and I just moved from Indiana to Florida, and we redid our documents because some of these documents are state specific, and they have some subtleties that are a little bit different on how states would honor those documents. And that's important to be aware of, so that your wishes are clearly communicated and legally valid in wherever you happen to be residing. Okay, so let me ask you about barriers. So tell me, what barriers have you observed from the faith community as it relates to advanced care planning?
Again, some of the biggest barriers are we just live in a time where we really have bought into that the healthcare system can make you better or extend your life. The healthcare system all has, and this is a health literacy word, algorithms or processes. So when you enter the healthcare system, if you're entering with heart disease or diabetes and heart disease go together, they're going to follow a process of managing. And those processes can be very lengthy, and the bottom is going to be the advanced care planning process. So it becomes a burden. And here, now that I live in Florida, one of the biggest things I would say that we've found out during this pandemic, you have family here and you may have family far away, and they're already in the system and there's no document. And that really, or there's not even who you can get a hold of, because families sometimes have even become estranged.
Yeah.
And once you enter the system, the healthcare system is going to do whatever they can, even if to maintain your life, even if it's in a chronic disease state.
Yeah.
And it can be very costly and burdensome over a time. So I guess, again, getting the church needs to be the first line of defense there.
Yeah.
And we just, the church is also dealing with, which we brought up at the very beginning, the mental health issues as well, this day and age. So it just becomes quite a burdensome for everybody. So getting them to buy into it. Usually it's got to be somebody at the church that, again, that, oh, I've completed mine. And and they'll say, one with this.
Right. And I think you brought up good points too, that I think in the church communities, that in my experience, is there's a lot of trust for the medical community, and rightly so in some regards. I mean, if you have certain issues, the hospitals and medical system can help in some issues. But like you said, once you're in that system, if you don't give them any indication, them being the medical community, of what your desires are, they're taking you down a path of aggressive full treatment. And that might be fine for you, but it might not be fine. And so I think looking at respect for life and what dignity looks like in dying, and that knowing that we're all dying at some point and no one's going to live forever. But how do we navigate that as a faith community so that we can honor life and respect life and not, artificially prolong suffering, to be quite honest. And so making those faith communities aware of that is really, really important. And I think the church and the faith communities have a very important role looking at doctrine, looking at their theology, and how does end of life fit in that. And there's some ranges and variations among faith communities and what their belief system is. And I think that's okay. But just knowing that if you just trust all of it to the medical community, you might be going down a path that you hadn't really thought you would be going down. And that could be a prolonged suffering that you didn't anticipate.
I think one of the other keys too, again, for faith community nurses that may feel a little uncomfortable with this topic, and you've only been in your church program a year or maybe even 5 years. If you do not feel comfortable with the topic, I challenge you to find a palliative care or hospice nurse, because they are generally trained in this type of work. Also ask them, though, if you know a hospice nurse or a palliative care nurse, ask them how long they've been in that particular field. Because if they only have been in it a year, I'm not so sure they feel comfortable either, because they're still learning. So I would really, unless they've moved from one hospice program to the other, that I would do, because you could have a partner there that would help you with this kind of presentation or discussing this in a church. And here's the other key that I would like to put in this podcast. If you do one of these presentations at your church, and you've invited everybody and you think 10 or 20 people are going to show up and only 3 show up, please do not be disappointed. Remember, Jesus healed 10 and 1 returned. If only 1 person shows up, they were brought there divinely. And do just go ahead with the presentation, because they may have something that they want to say that again, you could be the intentional care of the Spirit during that time.
Absolutely. And I think that's a great point too, as faith community nurses, to encourage each other to realize that we don't have to have all the knowledge, right? But there's no way. But just knowing how to point people but being ready for those questions. And I'm sure any nurse that's listening to this program would understand that even if you decide I have no plan at all to do anything with advanced care planning, if they know you're a nurse in your community, in your faith community, you're going to get questions about things. And can you still hear me, Lanet? Okay, but I can't hear you. So we'll continue to as Lanet gets her audio back, and I can edit some things too. So, but I think that knowing to be ready for questions as your membership comes to you. So you may have no plan whatsoever to address advanced care planning, or have any idea even how to approach end of life conversations, or how to get people connected to palliative or hospice care services. But people are going to ask you that. So, even looking at some of this through the lens of, just in case, a divine appointment, I'm in a potluck and someone next to me as they're getting their macaroni and cheese says, "You're a nurse. What do you think about this 5 wishes thing?" So you're going to get those questions. And I think being prepared for that will help. So we're working on audio again. And so,
all right.
As we finish up our program, I'd like to just ask Lanet, is there anything else you'd like to share to a faith community nurse? Let's say someone that's really brand new, getting started in this wonderful work called faith community nursing, parish nursing. What would you advise them?
I really would advise them to, and like myself, I spend a lot of time looking at programs, or even just talking with other faith community nurses that may have a little more expertise than I do. Mm-hmm. Because you really need that. And faith community nurses are so good about helping each other as well. So don't hesitate to reach out. Again, Lorie will be sharing this podcast, and this is some of her work as well. You could reach out to her. She knows how to get a hold of me as well, so that we can help guide you through it, because it is a special type of work, which now I've got an investment of about 7 years in it as well, of having a, again, the certification process of it, of advanced care planning process. Again, it's a process. Try to read up on some things that deal with advanced care planning. There's some wonderful websites that I'm sure Lorie will share with you that you can also have access to. Again, it's a very special training. I look at faith community nursing, and there's so many avenues for faith community nurses. They always say from birth to death. But what are some of those things that you're going to place inside of your program and say, I want to do this, and I really want to try to do it well? And that would be my suggestion. If this is one of them, really seek out the other experts or other people that can help you.
Great point. Great point. And I think, like I mentioned before, that the Westberg Institute is a great site, source of support and information on a wide range of topics for faith community nursing. Faith Community Nursing International is another group that also has a wide range of supportive topics. In the Advanced Care Planning Training Tool, which you'll be able to have access to electronically, there'll be a wide range of the available resources about advanced care planning, which include things like respecting choices. We mentioned that. The Conversation Project, which is a very simple, easy, doable resource that you could do in probably 10 minutes, to be quite honest. If you didn't have a lot of time, you could do a small bulletin insert, give some people the website, and that could be your program. I mean, if that really could be that simple to just get people talking. Lanet had mentioned before we start our podcast that Thanksgiving's a great time to start thinking about these things. People are going to be together, and you don't have to necessarily be viewed as the Debbie Downer of the family to bring up the topics, but you could certainly just say, hey, I filled out my living will, and I filled out my healthcare surrogate form, or maybe I filled out the 5 wishes. You talk about what you've done, and that might spur on your family too. So,
right. Have you heard of? You've heard of the Go Wish cards as well, right? I think every nurse, if you have They're not that expensive. They're kind of, you pull out a deck of cards when you're with your family, because these cards are used for, they've got sayings written on, and you can just kind of flip through the cards to help spur the conversation if you, don't have the words or you're struggling. The other thing is, respecting choices is really rolled up under a program now called the Coalition to Transform Advanced Care. And I think if you go to that website, which I'm sure Lorie will also provide, you will see multiple members of that organization now. And it's really coming together. And when it means transform advanced care, again, how do we look at and preserve the dignity at end of life, and how the care will be given for, are you going to be in your home? Are you going to be in a facility? I think you're going to see more and more people being in their home toward end of life, as we move through the future. And so anyway,
Absolutely.
Thanks, Lorie.
Well, thank you, Lanet, so much for your time again, and your commitment to whole person care as a faith community nurse, and really your expertise in advanced care planning. I mean, it's wonderful to see it's wonderful to see a faith community nurse who's so dedicated, but also really took time to go through some robust training and can do some wonderful things. I'm sure you've touched a lot of lives, and definitely appreciate you being here. And I want to mention again that we will have at the end of the video some links to various websites for you to look at. They'll also be available in the Advanced Care Planning Training Tool for faith community nurses too. So again, I think we may have lost Lanet's audio again. Oh, there she is. So thanks again,
I'm
Lanet.
here. Yeah, thank you. I appreciate the time, taking the time, and it was an honor.
All right. Thanks so much.